All right, my friends. Okay, this is a board review topic. It's Pete's talk, and we are going to be focusing on the pediatric skull. I was originally going to call this the ugly babies talk, but I thought that would be mean. I don't want anybody to think that I'm mean, so we'll call it weird looking heads instead. Or I guess if you want to go with the smarty pants word, this thing, craniosynostosis. So it's a fancy word, means premature fusion of one or in some cases multiple cranial sutures. So the consequence of this is a weird looking head and face, and consequence of that is difficulty getting a date to the prom. So besides looking like a gremlin, there's some other problems the kids can have: increased intracranial pressure. In some cases, the optic nerve and stuff can get screwed up. Visual impairment, deafness, certain forms that'll favor the posterior fossa can even cause venous outlet obstruction. I've seen weird cases where they'll show jugular vein stenosis, outflow limitation, and a whole bunch of venous collaterals and stuff like on MRV and things. And that's more advanced stuff that I wouldn't expect to be on that would not be consistent with an intermediate level, quote unquote, intermediate level exam. So it's unlikely that that kind of stuff would be on there, but just know that it can cause more problems than just making you ugly. And the big thing, probably, if there's any kind of sequelas, some of these kids get hydrocephalus. But we'll talk about that kind of stuff as we progress through here. So first things first, I guess we need to talk about what the normal sutures are and what the normal ones look like, and we're going to do a review of the anatomy here. So this thing here is the anterior fontanelle. If you've done any pediatric ultrasound of the head, that's the thing that you scan through. That's the quote-unquote soft spot of the cranium, and it's generally open for a couple of months, 6 to 9, in conditions where the kids might have